Hello, everyone, and welcome to our on-ramp series, Navigating the Pre-Clerkship Journey as a Warrior M.D. We're very excited to welcome you to this webinar. While we wait for people to get into the webinar and join us, as we see that number kind of rising on participants, wondering if you might utilize the chat function and tell us where you're joining from, city, state, and how you're doing today. I'll give that a moment. Make sure our chat functionality is working. Fantastic. There we go. All right, seeing some Orlandos. I'm headed down there. Our admissions office is headed down there for a heat wave tour soon. So if you're around Rollins College, we'll be there actually tomorrow. So if you have a chance to stop by in Florida, check out that tour. Rhode Island, lots from Michigan, Ohio, fantastic. So thanks so much for joining us. I know people will continue to come in, but again, welcome to today's webinar. We're super excited to have you. Today, I just want to start with some housekeeping items. So please note that microphones and cameras are off for participants upon entry, but please put any questions or comments that you have in the chat. We'll try to get back with you via those questions as the chat's going, but definitely there will be a Q&A session as we move toward the end of this presentation portion of this webinar. So we look forward to hearing your questions and getting those answered by our faculty, alum students today. So one thing, please be sure you're addressing any questions in the chat to everyone so that everyone can see your question and that all the panelists and moderators can see the same questions that are being asked. So please note this webinar is a series of webinars by the Office of Admissions. Should you wish to learn more about our curriculum, clerkships, research, community service opportunities, or more, we have a lot of great webinars already posted on our YouTube channel, which is linked to from the footer of our med.wayne.edu site. And this one will also be recorded, so please check back on that YouTube channel in a little while to see this recording there. We'll also email it out as well. And then, of course, you can always reach out to our admissions office at mdadmissions@wayne.edu with any questions. So the format of this webinar will include brief presentations by our faculty and alumni deans and administrators who will dive into the pre-clerkship curriculum with you so you can get a better sense of all that entails. And then we will introduce you to a few students who have joined us as well so that they can share their perspective and experiences with you too. And so before we get to everything, let me just make sure. I don't think I see Dr. Harold joining us yet. She is our Dean of Admissions. I do know she was planning on attending, so if and when she is able to come into the meeting, we will give her the floor to give a brief introduction. But without further ado, Dr.
I'm here, Chris. You don't see me?
Fantastic. Thank you.
Okay.
I could not see that you were joined. So
Okay.
Dr. Harold is our Associate Dean of Admission. She's an alumna of the institution. She's Clinical Assistant Professor of Obstetrics and Gynecology, Department Chief of Obstetrics and Gynecology at Sinai Grace Hospital. Dr. Harold.
Hi, well, thank you all for having me here to welcome everyone. Again, welcome to Wayne State University School of Medicine. I am Dr. Patrice Harold, Associate Dean of Admissions here, alumni class of 1989 and a proud warrior. I'd just like to welcome everybody this afternoon to this wonderful session that the Admissions Committee is having. And hopefully this gives you a good insight of, what that pre-clerkship years look like. And again, looking forward to seeing you all one day as a Warrior MD. So welcome.
Thank you so much, Dr. Harold. Appreciate that. Okay, and so, yeah, without further ado, we'll ask Dr. Paul Walker, who is Wayne State University School of Medicine, Professor of Ophthalmology, Visual and Anatomical Sciences, and Director of the Medical Gross Anatomy course, which offers a full cadaver dissection experience to Year 1 medical students. Dr. Walker, would you please start us out? I believe you're on mute, Doctor.
Yeah, I just realized that. Welcome, everyone. I'm very excited to talk to you and excited that you might be joining us come the summer. So I am also the assistant dean for the M1 segment, which means that I'm in charge of your first 9 months. And what you see on the screen is the entire 4-year curriculum. And we have a number of other faculty that are heavily involved in that are here today to talk to you about their sections of it. But I'm going to focus on when you arrive in July and go through orientation, you will be participating in the M1 segment, and that's what we call it. And this is a 9-month segment before you go into the disease part of the curriculum. And we focus on the healthy human patient, the structure and function of the human body. The segment is divided into 3 terms. Each term is 3 months. And so you can see the yearly monthly schedule. And you might note at the top here, there are 3 courses, each 3 months each, that are titled Human Body Foundations. So there's 1, 2, and 3. And these are courses that are systems-based, and they are taught by faculty experts in their disciplines with focus on the various systems that are being covered at the time. Alongside of these 3 courses are longitudinal courses that introduce the physicianship part of medical school. So we have a clinical skills longitudinal curriculum that spans both segment 1 and 2, and Dr. Miller will be talking about that. We have a course that is abbreviated P4, that's population, patient, physician, and professionalism. And Dr. Benjamins will be talking about that. And then we have a unique service learning experience that is really our stamp in terms of the Wayne State Warrior strategy, and heavily embeds our students in the city of Detroit. So I'll be talking to you mainly about the HBF1 sections of this. After after segment 1 is over, you'll advance into the disease part, which is another 9 months. And this is called Human Disease Foundations. That's segment 2. And along with that, you'll have a step 1 preparation curriculum that gets you ready the entire time to go into past the USMLE step 1 exam. And there's an entire dedicated period that allows you to do that. And then you go in after that to the clerkship years. And this goes very quickly, as everyone can tell you. So I'm going to break down the first 9 months a little bit with this next picture. And what it does is it shows you the 3 courses across the 3 terms. And the emphasis on this slide is the disciplines that are taught. You'll notice anatomy is taught longitudinally across all 3 courses. So we have a full dissection, a full cadaver dissection program that the students participate in, and I'll talk more about that. We have histology, which is microscopic anatomy. This builds the foundation for your understanding of pathological processes that you'll get as an M2. We have instruction on how the human body develops and all the mechanisms that go along with that. We provide instruction on biochemistry and physiology mechanisms. And then we introduce pharmacological principles quite early in the curriculum. And so you'll have that spread across both M1 and M2 segments. Another longitudinal set of threads that you'll see are that we do a lot of medical imaging training. We do research and evidence-based medicine that Dr. Benjamins will elaborate on. And then we focus on developing habits of self-directed learning, which physicians need to carry on throughout their career. One discipline that I have over on the right here that is in purple is what the students are doing right now, in fact, is they're involved in the HBF3 course, and they do heavy study of neuroscience. And so some of the students that are with us today will be able to comment on that. So the way these are broken down in terms of systems are that the HBF1 course is mostly focused on the musculoskeletal, peripheral nervous system, skin, and vascular. And for that, during the anatomy labs, we will be dissecting the upper and lower extremities. After that, we transition into more of an internal medicine approach with cardiopulmonary, GI, and renal systems. And for that, we're dissecting the thorax and abdomen part of the cadaver. And then we transition, which we're currently doing now. We study the reproductive and endocrine systems. And also we'll study the central nervous system, the brain and spinal cord. And during that time, we're doing pelvic anatomy and head and neck anatomy. Now, the way our anatomy program works, it's full cadaver dissection, but we employ a unique approach called dissection handoff. And the way this works is illustrated on this slide. We have 30 gross anatomy labs, and they all take a lot of time, but this strategy allows the students to really participate as teachers while they are learning the material. So the way it works is that there's each table of students is divided into group A dissectors and group B dissectors and group B receivers. And group A dissectors will dissect on the odd number labs for a given HBF course. And the group B receivers are not there during this time. Group B dissectors, or group B becomes dissectors during the even number labs, and group A becomes the receivers. So during the handoff, after the lab is over and the group A or group B dissectors have done their job, they invite their receiving team into the lab at a given time, and they will present the dissection to them. And what that does is it encourages the practice of accurate communication, the passage of information from one team to another. It's kind of like a patient handoff in that, the group has to participate with the communication going back and forth, and there's accountability in terms of one team versus the other. And that's very important for the students to understand, is that process of accountability. And this goes on in a circular way throughout all 30 labs. So by the time the gross anatomy dissection sequence is over, both teams get to do a lot of peer-to-peer teaching and learning to learn about the human body. So this is just an example of what it looks like in the gross labs. This is on the first day where they're beginning to make their first cuts, and you can see the entire team happens to be there while they're learning how to dissect, and then thereafter they're in their group A and B teams. Now, in addition to gross anatomy lab, which is a very active learning experience, our curriculum is designed as an active learning curriculum. So we do offer pre-recorded lectures, but it's a flipped classroom approach in that the student will obtain the material prior to coming to an active learning session. And these sessions include histology lab, neuroscience lab, which is what is ongoing in the HBF3 course. We also have biochemistry team practice, physiology case-based learning. We have a unique pharmacovigilance experience that students use their pharmacological principles to do some case-based learning. Radiology training is done in the M1 segment. We started probably about 20 years ago to offer ultrasound training, and that was we were one of the first medical schools in the country to do that longitudinally. We also have EBM, or evidence-based medicine small group, and then problem-based learning is part of our curriculum, and self-directed learning through first patient. These are two self-directed learning exercises that we do in the curriculum. So this is just a small snapshot of what we offer to you as incoming medical students. And I believe now I am to hand off to Dr. Miller, who's going to provide the next part of the talk.
Thank you, Dr. Walker. My name is Dr. Erin Miller. I am the co-course director of Clinical Skills 1 and also the medical director of the Clinical Skills Center here. So I can definitely speak to all of the programming that we offer at the Clinical Skills Center. As an aside, I am a graduate of Wayne Medical School. I graduated in 2013, and I'm living here in the city with my husband and our two small kids. I think it's a fantastic place to be. So the Clinical Skills Center is really this place that we've designed to be a safe space for you to come and learn communication skills, physical exam skills, procedural and clinical reasoning skills that you're going to draw from for the rest of your career. So clinical skills 1 and 2 are offered in segments 1 and 2 respectively of the curriculum. And these are courses that are designed to give you a chance to really practice the skills that you are going to need for the rest of your career, starting from the first days of medical school in an environment where it's okay to make mistakes because that's how you learn. We offer sessions that utilize standardized patients who are trained individuals that deliver cases so that they come, it's as if you were walking into the clinic to see somebody coming in with knee pain or chest pain or headaches. And they offer this chance for you to work through the ways that you would approach patient in real life. The other thing about Clinical Skills 1 and 2 that I think is really important is that we've designed these sessions to integrate into what you're learning in the rest of the curriculum. So when you're learning about, the anatomy of the heart with Dr. Walker, and you're learning about the way that the heart actually functions and physiology, you're also learning about where to put your stethoscope when you're going to listen to somebody's heart and how to analyze that information. The way that these courses are built are using something called scaffolding. And what that means is really, we're giving you the support to build your skills one step at a time. So you should never feel like you're getting thrown into the deep end, and you should never feel like you're just kind of going through the motions because you've done this a million times. The hope is every time you come in, we're pushing you to grow in at least a couple of areas so that you're continuously learning when you're with us. Clinical skills 1 and 2 are kind of designed to work, one after the other and to build you up. And so I wanted to just kind of give you an example of what that looks like. So in clinical skills 1, you're learning how to take a history. You're learning what questions you need to ask a patient to get the relevant medical information. You're learning how to do that in an empathetic and responsive way. You're also learning the basic physical exam skills. You're learning to write notes in the patient's chart and also how to present the case to, someone else on the team. The physical exam you're learning in Clinical Skills 1 is something called the Core 30. These are the 30 exam skills that directors of clinical skills across the country have agreed are really the most foundational. You're always going to need to know how to listen to a heart. You're always going to need to know how to do a basic neurologic exam. And so we're really starting those early foundational skills from day one. You'll come in for 10 sessions over the course of segment 1. And we'll also start to help you to think about how a doctor approaches a case. How do you develop a differential diagnosis? How do you kind of take all of the information that you've gathered and boil it down to what's most essential to know in order to develop your treatment plan? And our goal is really to help you to be ready to enter the continuity experiential clerkship in your M2 segment, which is where you'll go out and you'll be paired with a primary care doc in the community and you'll start to see patients. My hope is that you're going to spend a lot less time thinking about the mechanics of seeing a patient and more time learning the medicine and the art of medicine with the doctor that you're working with. In Clinical Skills 2, our focus pivots to preparing you to thrive during your clinical rotations in the hospital and in the clinics as an M3 student. And so kind of the ante is upped just a little bit. You're still learning history taking, but you're thinking about what history you may want to take for a pediatric patient versus a surgical patient. You're learning additional communication skills. The physical exam starts to get a little bit more specialized. You're learning, again, how to write notes for a particular specialty and how to present that case. You're also getting a little bit of a taste for medical procedures. So we introduce things like giving an immunization or learning how to drain an abscess, get a wound culture, do a pelvic exam. So you're learning kind of some of these foundational procedures as well in your second segment. You'll come in for 8 sessions, and then you're also getting a chance to apply your reasoning. So now that you have an idea of what you think might be going on with this patient, what tests do you want to order to confirm your diagnosis? And how do you want to treat the patient going forward? So just to give you a sense of what it looks like when you come into the Clinical Skills Center, we start out with a pre-briefing, which is where the small group of students who will be going through that session together meet, talk about kind of the expectations for the day, and any last minute questions are answered. Then for most of your sessions, you'll be going in with a peer. for year one. So you'll have a chance to not only complete the encounter yourself, but also to watch your peer go through it, because sometimes you learn more when you're not in the hot seat and you can notice, oh, I wonder why they asked that question, or maybe they should have approached this in a different way. And so after you go through your encounter, both the standardized patient and the peer will give the person conducting the interview and completing the exam some feedback. And then the student who's just completed that encounter will have 15 minutes to write their note. Then the other partner will go. And then finally, at the end, you'll go deliver oral presentations. And you'll also have a debrief where you can talk about kind of the case, unpack the case with a physician and think about what you learned. And also to kind of start to develop skills you may use the next time you come in. Our course is pass-fail because this is what we call competency-based education. Our goal is not that you hit a specific letter grade, it's that you maximize the skills that you're going to need for the rest of your career. We also offer coaching for any students who need it, and then also any students who would like it. So this is just to give you a sense of how you're assessed. You're assessed on this rubric. Every time you come in here, you get this feedback electronically for your review in the future, along with some narrative comments from your standardized patient. And you can see that kind of the hope is over the course of the year, we move you from being in this entry column all the way over to advanced beginner so that you're ready to start the year 2 course. And these are something that I introduced this year just to make sure that we keep the focus where it should be. So I always just remind the students that you're learning all of this because your future patients deserve an excellent physician. And that's really what we deliver here at Wayne State. And it's why you chose to go into medicine. And then I also like to just ground students in the idea that you're here in year 1 or 2, depending if you're clinical skills too, of a 7+ year journey to clinical expertise. So you're not going to know everything right away, but we're going to kind of one foot in front of the other, get you to clinical expertise. So that is what I have for you. And I will turn it over now to Dr. Benjamins.
Thank you, Dr. Miller. Welcome, everyone. Good afternoon. Thank you for having me here. I'm Dr. Benjamins, and I'm the director of the P41 course, as well as co-director for P42. I'm also the discipline director for the evidence-based medicine and clinical research curriculum that I'll be talking about. And just to give you a little background about myself, I also am a Wayne State alum, class of '98. Both of my parents were also on faculty at Wayne State for most of their careers, so we're a big Wayne State family. And after I finished medical school at Wayne, I went to Houston for over 20 years to complete training in internal medicine and pediatrics. I then went on to specialize in adolescent medicine and primary care, and I've also done some training in HIV care. I was lucky enough to move back home about 3 years ago, and I'm really excited to be part of the Wayne State faculty, giving me a chance to give back to the school that really gave me so much. I can honestly say that my training at Wayne not only allowed me to get into a pretty competitive residency program, but it also gave me the tools to really thrive there. And so I'm really proud to be part of the faculty. Today, I'm going to be introducing you to 2 key components of our medical school education in the preclinical years. I'll be talking about our population, patient, physician, and professionalism course, or P4 for short. This is a longitudinal course that integrates social and behavioral health and health system science. And I'll also briefly be going over our evidence-based medicine and clinical research thread, which spans all 4 years of the medical school curriculum. Both of these are essential for shaping how our students analyze clinical scenarios, communicate with others, and make decisions as future physicians. So I'll start with our why. One of the quotes from Dr. Martin Luther King: "Of all of the forms of inequality and injustice in healthcare is the most shocking and inhumane." Dr. King was also famously noted to say, "Life's most persistent and urgent question is, what are you doing for others?" The why of P4 relates to our commitment to serve our community and to help shape future physicians who recognize their role beyond the clinic and who advocate for their patients. P4 is designed to help you develop a deep understanding of the social determinants of health and ethical medical practice. Medicine is not just about diagnosing and treating diseases, it's also about understanding your patients in the context of their lives, communities, and the broader healthcare system. We do this through introducing our students to patient-centered and culturally responsive care by teaching evidence-based frameworks of care that help reduce healthcare disparities as well. Our hope is that our courses support our students to develop their own professional identity, as well as foster self-directed lifelong learning. In your first year of P4, you'll engage with key themes that challenge you to think critically about medicine's role in society. And by the end of P4-1, we hope that our students are able to not only describe the psychosocial and cultural influences on health behaviors and outcomes, but also learn how to apply strategies and advocate for reducing barriers to healthcare equity. We also want you to be aware of principles of biomedical ethics and apply these concepts to clinical situations, identify population health, social determinants of health, and policies that impact access to healthcare, and then learn about how our own internal beliefs and biases help to shape our professional identity, as well as impact the care that we deliver to our patients. Here's a list of the different topics that we hope to cover over the next year. Year 1 is structured in a flipped classroom model. So we have assigned readings for you to review during the week that we cover this topic. There are oftentimes essays that you might also read or videos to watch. And then during the week, we have a 2-hour session when you are in a small group, usually about 16 to 18 students, and the group is facilitated by a faculty member. These faculty members may be from Wayne State or Henry Ford Health System, but we also have community physicians that are Wayne State alum. The topics that you see in italics here are topics that are going to be new in the upcoming year that we're trying to introduce into the curriculum as well. And as of this present year, we also introduced a journal club article for each session, and that ties in a little bit to the evidence-based medicine curriculum that I'll be talking about in a minute. As you transition into your second year in P4-2, we shift a little bit more towards the practical application of these topics and focus a little bit more specifically on certain populations. And so by the end of P4-2, we hope that you can identify health disparities in these populations, specifically focusing on those who are underserved or marginalized, but then also examine at the micro, meso, and macro level the different factors that contribute to disparities and effective strategies to address these disparities. And we continue to encourage you to reflect on your own internal beliefs and biases as you develop your professional identity. These are the topics that we cover in P4-2, and it's structured a little bit differently. So we have a few sessions that are large lecture didactic sessions where we have people who are expert in their field come and talk to us. We also have several panel discussions, including people with lived experiences, as well as healthcare providers within certain healthcare systems. And we also have sessions where groups will break off into smaller groups to either interact with a person with a lived experience or do their summative projects, which are required at the end of each term. So currently we're covering things like professionalism, but also food and housing insecurity, as well as veterans health, people living with disabilities, and correctional health care. And those last 3 topics include panel discussions, as I mentioned before, with people with lived experiences. As of this past year, we added some new content on health insurance, including payers like Medicaid and Medicare. We introduced some topics on environmental justice and how changes in the environment impact health. We also had a few sessions on birthing persons and fetal health with a real focus on the epidemic of poor outcomes when we look at maternal fetal healthcare outcomes, not only locally, but nationally as well. And in the upcoming year, we're hoping to introduce information on the medical legal partnerships, which are becoming more common throughout the country. This is a picture of one of the summative presentations from one of the small groups that I mentioned. Students are assigned certain topics that they have to investigate. They have to look into what are contributing factors to a certain problem, as well as what are some solutions and local resources available to address those disparities. These small groups are actually facilitated by M4 students, as you can see here. So while in P4-1, we have faculty, medical physicians facilitating those small groups, for in M4, I'm sorry, in P42, we have M4 facilitators facilitating these groups. And just really quickly, the evidence-based medicine and clinical research curriculum is a thread that is longitudinal and was officially launched in 2022. And as I mentioned, it spans all 4 years of the medical school activities. And we integrate essential research and analytical skills into the curriculum with the aim to foster evidence-based clinical decision-making and develop lifelong skills essential to the practice of medicine. In year one, we really tried to give you some of the foundation that you need in order to do some research while you're a medical student. So we talk about not only clinical trial phases, but study design, ethical considerations, how to do effective literature searching, as well as how to navigate the IRB. We also, during this time, teach you basic concepts of epidemiology and biostatistics and have you practice calculating things like rates, risk ratios, sensitivity, and specificity in those small groups that Dr. Walker mentioned. And these small group sessions are actually facilitated by year 2 students. And as I mentioned, we also are introducing journal clubs into the P41 curriculum during this time. In year 2, we build on these skills as we incorporate what you've learned from year 1 into looking at different manuscripts, using critical appraisal tools to look at research papers and journal clubs. And we try to align those journal clubs with the topics that you're learning in the Human Disease Foundation course. We also continue to do practice solving questions and reinforce concepts from year 1. You have the opportunity to be a near peer small group facilitator for the year 1 students. And we also have continuing review through online lectures and other practice test questions to get you prepared for step 1. We continue the thread into year 3 and year 4 with some quarterly assignments based on some of your clinical experiences. We ask students to come up with a clinical question that then they have to do a literature search on and then find a manuscript to answer that question, then critically appraise. And the 4th year students then act as mentors to review that information and give feedback. And we hope through all of this to create a strong Warrior M.D. I know that was a lot of information in a short amount of time, and so please feel free. I know we have some question and answers at the end, but please feel free to reach out to me at any time as well.
Thank you so much, Dr. Benjamins, Dr. Miller, Dr. Walker. We really appreciate your slides and conversation there. Just of note, in addition to Human Body Foundations, the P4 course, clinical skills, and electives, we also have a longitudinal service learning thread throughout the curriculum. And just wanted to give you a heads up, we have a lot by way of past webinars talking about service learning content. So again, if you want to hit up our YouTube channel and look at that, Dr. Mendez is a great resource, and she's been featured pretty recently again with regard to service learning. So just want to let you know that. And then next up, we wanted to introduce a few of our outstanding students here at the School of Medicine to give you more of a student perspective on our curriculum and what they kind of are experiencing now. So I'm going to go through, and maybe if our students, David Pagowski, Alexis Bowles, and Trevor Buck, thanks so much for joining us. If you would maybe introduce yourselves a little bit, mention where you're at in the curriculum, what year you are, why you chose the School of Medicine in Detroit, and then what you like most about the MD curriculum thus far, or what surprised you. So David, how about if you want to go first, then Alexis, then Trevor? Okay, thank you.
A pleasure to meet everybody. My name is David Pagowski. I'm a 2nd year medical student. I'm right at the tail end in the step dedicated period, so about to be moving out of the clinical side. Initially, I chose Wayne State due to its connection to the community. The service learning is a really huge component here, but it's a really great symbiotic relationship between the community and the School of Medicine. And so we kind of have a nice relationship there. And it's really kind of rewarding in medicine to see when you're able to actually help people with the limited knowledge that you have. And it's very nice for that. The other side of it is that Wayne State has a ton of connections, and I know one of the major questions that a lot of people have with Wayne State is, I'm coming into a class of 300. How am I going to know everybody? Does it feel like you're just one in a giant sea? But Wayne State does a really good job of making sure you don't feel that way with your anatomy groups and stuff like that. The flip side of it, though, is once you're kind of out practicing in the world, there are 300 other people who are very closely connected to you from that class. And then the class before had 300, and the class before that had 300. So you just end up with a really large network and connection to different residencies and all kinds of stuff like that. Trying to remember the last part of the question. I'm sorry, Kristen.
No problem. Anything about the curriculum that has really struck you as exciting or surprising, or that you
Oh, yeah.
loved most?
For me, it was P4. Um, the curriculum there, like coming into medical school, you're like, how hard can it really be? Like, you just be a good person. But then you start to kind of look into and see kind of the disparities that are there in medicine, and see how people are impacted. And it was really powerful to hear. We have a lot of panels that come in for each section. And the one that really struck me was correctional medicine. We had a bunch of people that kind of came in and talked that had been through the correctional facility, and kind of hearing their stories about how their health was managed, and kind of the difficulties that they had getting what we would consider routine care, is really touching, and then puts you in a position where you realize that as a physician, you get a chance to make a difference. And I wasn't really anticipating that. I guess I kind of expected it was going to be like a show up for 2 hours, just do my thing. But it ended up being really kind of empowering and a kind of a change to what we see in the world.
Thank you very much. Alexis?
Hi, I'm Alexis. I am a first year medical student here. We're currently in our HBF 3 block, so the last block of the first year. I chose Wayne State for a couple of reasons. The first reason is because during one of my gap years, I worked as a scribe, and I had the the pleasure of working with two Wayne State alumni physicians, and they spoke so highly of the school. They talked about how supportive the faculty was, so that was very appealing to me. And then just being able to see how well they worked with patients and maintained physician patient relationships, it really put me on the path to Wayne State. And then my favorite part about Wayne State would be the community engagement and how it's worked into the curriculum through the service learning. I learned a lot about the social determinants of health that we discussed in P4 in undergrad. And it was one thing like hearing about it and then seeing it. And so we kind of get to see that when we go out into the community. So that's really my favorite part about it. And I'm sure to be everyone's favorite part, when you guys come. Another favorite part about the curriculum for me is the electives. I've never done research, so I was able to join the research elective and have learned so much about putting a research project together. And right now we're actually working on how to do a literature review. So I feel like that's really helpful. But overall, I really enjoy the school. I've learned so much. I can see how we would be strong physicians in the future. And I'm sure you guys would enjoy it too.
Thank you very much, Alexis. Trevor?
Yeah, so I'm also an M1 like Alexis. So if you choose to go here, you'll be in our shoes 1 year from today. So you can get excited for that. Why I chose Wayne is I really like the urban center school. It's a great school within the state of Michigan as well. And I think there's just a lot of opportunities within the city that allow you to exercise like the service of a physician that's so central to that role. My favorite part of the curriculum is the gross anatomy lab that was described earlier in this presentation, just because I think it's such a unique opportunity within Wayne State. It's not something that's done everywhere. I think it's a really valuable experience to really get that anatomy down and really learn it to your core. And that is something that occurs in M1, but you also have the opportunity to come back in later years and review that anatomy in a way that will prepare you for residency. Yeah, I love it here in Midtown Detroit. It's also home of Little Caesars Arena. So if any of you guys are sports fans, there's the Red Wings and the Pistons that play just a mile from the school. And if you guys ever want more personal advice or resources on living in Detroit, I'm in charge of the group me for your guys' class. So just feel free to reach out. I'm always available. And yeah, that's what I got.
Thank you very much. I feel like we should probably mention the Lions as well, right, at this point. And
I'm trying to forget about the Lions for the time being.
Sounds good. Well, thank you all so much for joining us too. And so let's move into the Q&A portion. I know we did receive a few questions within the RSVPs, and we have some other questions that came in. First and foremost, what's the day-to-day schedule like for students in pre-clerkship and clerkship phase? How much independent study time and how often are you in class during the week? Would any students like to take that on? And
I can
or
take it on.
okay. Mhm.
So depending on how specific you want to get, so you're going to have anatomy lab twice a week, which is one of the larger commitments. That's like a 3-hour block of time just for dissection, and then handoff as well. And then throughout the week, Dr. Walker had it listed, but there's neuro labs, there's biochemistry labs, there's histo labs that occur. Those are like Wednesday, Friday sort of sessions. So most days you will have active learning sessions or in-person events scheduled, but those events usually take 2 to 3 hours a day, and then the rest of the time is dedicated to studying the material in the lectures, as well as any P4 or service learning commitments you might have.
Very good. Thank you very much. I think I'm going to open this one up to Doctors Walker, Miller, and Benjamins. Just knowing our curriculum so in depth as you do, what do you think that makes it so unique as a curriculum set, and how do you think it best prepares our students to go on and be successful, compassionate physicians?
I will speak to that, but first I wanted to answer the question a little bit about the clerkship phase because I do have a little bit of understanding there. So with the clerkship phase, you'll be moving as an M3 through your required rotation. So you get 3 months on internal medicine and surgery, and then a couple of months, 2 months on pediatrics, OBGYN. You have a month of family medicine, you have a month of psych, and a month of neurology, if I'm not mistaken. And then you are really at the hospital a lot of the time or in the clinics, but you do have protected time every few Monday afternoons for the CRISP course. And so that kind of extends a lot of the themes we've been talking about for segment 1 and segment 2, further into your experience here at Wayne. So you get a chance to revisit some of the imaging, some of the clinical reasoning work. You really have a chance to come together as a class and think about some of the things that you've been applying in the wards through that course. So that's hopefully helpful, yes, for the students who are interested in what the clerkship phase looked like. I think, as a faculty member here and also as a former student myself, and then I did my internal medicine and pediatrics training just across the parking lot at the DMC. And now they can't get rid of me. I'm just kind of here for the duration. I think it's really special. The community, as many of the students have mentioned, is really fantastic. You get a chance to really, I think at Wayne State, apply what you're learning so early on from service learning. You really get a chance to get your hands dirty and get to work in the hospitals. And so, we really have a reputation at Wayne State of producing students who have just phenomenal clinical training. So you enter your residency ready to get to work and ready to see patients and ready to care for those patients in a really meaningful way. So I think that's what makes Wayne State a really special place to be.
I would second that, and that I felt like my training really prepared me well for residency. I feel like I was on par with my upper level residents in terms of how to manage patients, how to take notes, how to do an exam. I really felt prepared. And I was in a pretty intense residency program, so I was really grateful for that. But I think what struck me as a student, and that I continue to be impressed by as a faculty member, is really just that connection and that commitment to the community. So impressed by all the different things that our students do in the community, all of the different student organizations that exist. It's really phenomenal. And I continue to be impressed by that all the time.
Yeah, and then I'll just chime in and say that we hear back from residency programs about our students that we send their way, and our students are the ones that know how to do things, and they're not afraid to get dirty. I mean, they just go right into it, and they're fearless. That's what residency programs want, and it's our training mission is that way. We really encourage the students to, not sit back and watch, but actually do. And so that's what makes this a bit unique.
Okay, very nice. Thank you. I'm going to dive a little deeper here on some of these questions from the RSVP. So wondering, kind of going back to student schedules and budgeting time, and I know a lot of students on this webinar are very involved in many ways. Can you speak to budgeting your time to involve yourself in all the things you need to do for the curriculum and coursework, but then in addition, extracurricular volunteer activities, the research activities, Alexis, you were referring to. How do you go about budgeting your time?
Well, first, just only take on what you can handle. I think that's really important. I'm involved in 3 orgs as well as the elective, and I feel like that's just something I've been doing since undergrad. I've been able to manage my time well, but I have my school calendar on my Google Calendar, and from there, I just kind of arrange how I want things to flow. And then everyone in student orgs, we're all students, we're all doing different things, so we all just kind of do things when we all can, and in a way it won't affect us. So I think you just kind of have to, before coming, work on your time management skills and making sure you know what you can handle so that you don't take on too much and feel overwhelmed, and then you don't have time to do anything. So I know some people only do like 1 or 2 orgs. I was just trying to be an overachiever and did 3, but just do what you can handle and know how long it'll take you to get things done so you can plan accordingly.
If I can add to that too, Wayne State does a really good job of kind of titrating you to the level that you can handle. When you first get to campus, your entire goal is just education. So you have to demonstrate that you can do what you need to do on the academic side first. And I think it's 3 months or so in before you even have the opportunity to start seeing board applications and things like that. Um, and so because of that, you kind of get a feel if you're struggling academically, you know you don't really have the time to take on other stuff. But then once you start taking on orgs, then you have electives that get introduced after that. And so it kind of slowly works its way up and you can kind of follow your progress that way. It doesn't just all throw at you day one, go join 1 billion orgs and also do all your medical school stuff on top of that.
That's a great segue into the next question, which is about electives. Can you discuss some of the electives that you're involved with and or that other students are involved with?
I can start with that. So I'm in the business elective. So Wayne Medical School, it has a unique program. It's a 4-year MBA MD program. So in order to get that journey kind of started, you take the business elective, and it's really been a lot of interesting content. We get to hear from CEOs and physician leaders all around the healthcare landscape and kind of hear the business side of practicing as a physician, which I think is really critical to understanding your role and how you can best be a patient advocate.
I also did the business elective and channeled that into the MD MBA program that starts at the end of the first year. Um, the commitment is honestly like very manageable. The schools work really well together to make sure that if you're on break at one school, you're on break at the other one. That way you don't have to be stressed about doing business on like your dedicated break, for example, of med school. Uh, but I know there are, I think, 6 or 7 total electives. I'm not 100% positive. I don't know if anyone else has that exact number that covers a lot of those ideas. Are you doing any, Alexis?
I'm only doing the research elective. I forgot all the other electives, but I feel like the research elective is pretty chill too. It's not a big time commitment. I feel like we only meet like 2 or 3 times in a block. So the first like part of it, we kind of just did journal clubs, like learning how to read a research article, how we could possibly write one. And then, like I said, now we're doing like literature reviews and how we would write a proposal. And then you can also take it during the M2 year and then kind of focus on board presentations and oral presentations. But I feel like it doesn't add too much to my plate. It's pretty easy.
Thank you very much. I added a link to the electives. If you scroll to the bottom of that page, you can see they're right at the bottom. There are about 5 listed, including business, basic science, clinical research, community engagement, and more there. So check that out. Kind of getting into the patient care, patient interactions. Doctors Miller, of course, Benjamin's, and students, if you wouldn't mind elaborating on the kinds of interactions, patient interactions that students can get in their pre-clerkship years.
Can start with that one. So, the kind of the beginning of medical school, all of your patient interactions are primarily standardized patients through clinical skills. It gives you the opportunity to get comfortable talking with people, which sounds really silly, but it's in that setting is very different than just an ordinary conversation on the street. And it allows you to kind of make all your mistakes early. I like to give the story of my first clinical skills session because we get the opportunity to look back at our videos. I went back for fun and watched my first one, and it's kind of scary, but you're just going through reading off your script because you're just trying to get all you can to get it right. And I was just only reading the script, all coming out my mouth, nothing going in my ears. And the standardized patient was trying desperately to get me to like show some level of just awareness. And so she was telling a bunch of like kind of fabricated but sad stories. And I was like, okay, okay, good. Yep. Okay. And just moved on to the next point, completely just blew through it. But looking at the more recent ones, it's really cool to see how that's developed. Um, and then going into your second year, you get placed in a clinical site around the city area, and you're there every other week for roughly 4 to 5 hours to see patients with a practicing physician. And it starts to feel a little more real, but you're really under their wing. So they're not going to allow you to flounder too much. But it's a good chance to practice getting exposure with patients in the true clinical setting, on top of the additional standardized patient work you get in clinical skills.
And just to add on to that, another avenue you can get patient interaction with is through, we have a lot of pretty robust student-run clinics, which is part of like the service learning. So in those situations, you'll be able to meet real patients with real problems and kind of work with a physician to, you know, practice your skills, practice a lot of the stuff you do in clinical skills with real patients. And I think we do a lot of good work with that sort of thing. One of like our premier ones is called street medicine. I think that's that's one of the orgs people really enjoy working with. And so that's an org that goes out and provides free supplies and healthcare to the homeless population in the city of Detroit. So there's multiple ways to get involved in the community and see patients at the same time.
Thank you very much. Anything else anyone would like to add on that? Okay. So another question, with the curriculum being online, the students asking for more insight on how students learn and study with others, or how they really receive help or mentorship from faculty. Open up the floor, whoever wants to jump in.
So I think how you study and who you study with is kind of, it's like, it goes person to person. Everyone has their own way. But when you come to Wayne, the first people you meet is your anatomy group. That's kind of the core you're going to be studying with for a lot of your time here. So there's shared Ankis, which is like the flashcard program. There's shared notes that get posted in the group chat and things. So there's people who like to study in big groups. There's people who like to self-study. It really just depends on whatever you like, and you're able to personalize your study habits to whatever you would prefer.
Any faculty members have perspective from their end on how you connect with students or make sure that that maintains?
Yeah, I mean, I would say, you know, for the best way that I've connected with students is in all the different small group kind of scenarios. So whether that's being somebody's first patient mentor and communicating with them back and forth about their research project, whether that's being a small group P4 facilitator, which is really, I think, you know, though I'm here to advocate for clinical skills, maybe one of the most meaningful ways that I've connected with students, because you have this chance like to see the students over 10 sessions. You're in a small group and you're discussing topics that become, you know, really kind of, they could be sensitive. They're very kind of challenging to grapple with. And you're having these deep, meaningful conversations for 2 hours, you know, several times a week. That's fantastic. And then the other thing, the other place that I really have had a wonderful chance to develop relationships with students is as a CEC preceptor. So I host students, a couple of students every year come and spend a half day with me over the course of months and months. And you really build that relationship with students and give them, whatever guidance is helpful for them. But it's wonderful to watch students grow in that capacity. And so I think the curriculum has been designed in such a way that there are all these touch points for faculty to kind of have interactions with students in smaller settings so that we really get a chance to get to know you.
Thank you.
Yeah, and I was just going to chime in and say that the students probably get a little sick of us after a while because we see them so much. That would be an anatomy lab and a lot of the other active learning sessions. And we're always available either in person or if someone needs a quick Zoom call or anything like that to discuss. And we reach out to students after exams. If they're struggling, we meet with them one-on-one to review, the exams with them. So we're very engaged.
Thank you so much. We do have so many offices here on site, engaged with students continuously to help them out with resources and so on, including student affairs, advising, mentoring, and so on. So, well, thank you all so much. I think we will wrap up this webinar today, but just a quick reminder that we do have a lot of other webinars currently on our YouTube channel already that you may be interested. Additionally, we have another one coming up in February with our financial wellness experts here at the School of Medicine, so they can help walk you through any questions or provide any tips that might be helpful as you consider your next steps and potentially coming here and joining us. So additionally, we just sent out word about our Second Look Day events coming up, and we're very excited about those. We have a virtual one on April 4th. So you can definitely join that as well as the in-person one on the 11th, or you can choose whichever one works best for you. So thank you so much. We hope to see you at those. Again, should you have any questions, please feel free to send them to mdadmissions@wayne.edu. We thank you so much to our speakers today, our guests who have joined us. We are so grateful for your time and expertise and experiences. So thanks again and have a great day.